up also. He hasn't seen it yet.
Dr. Mesham sir, we can ask him to have a few words afterwards whenever he comes online so that we can start the proceedings.
He's muted.
I think wait for another few minutes before we get some people also to join in. And Mansi, you can share the link for the YouTube and Facebook so that we can share with other people.
Yes, sir, I'll do that.
Dr. Padma, we didn't see you in the last DCGA meeting.
I was in the OPD. I wrote to them that OPD days is not possible.
Oh yeah, it was a Friday, I think. No?
Yeah. Either they're having it on Tuesday or Friday. So it's a problem.
Yeah, they are not listening.
Sunil, we are live now, so I would request you to restrict.
Acha, where is Arvind? Arvind has not joined.
Yeah, hasn't joined so far. I'm not able to.
Arvind would also gone to Singapore.
Yes, sir. He's also in Singapore.
Yeah. So now in Singapore it would be around 8:30 or 9. So I think they should be able to join. I don't see Dr. Kameshwar Prasad also.
I think Meshram 6:35 you start.
Yeah.
1 more minute and you start.
Yes. I think we can start now.
Yes, go ahead.
Yeah, because we don't see Jaira still joining.
You start. You start, please.
Yes. Good evening, everyone. Today is World Stroke Day. World Stroke Day means this day is dedicated to create awareness about stroke or brain attack or paralysis, or in Hindi it is called as Lakhwa or Pakshaghat. So it is celebrated all over the world to create awareness about this disease. And today, I welcome you all for this session. We have a very experienced and dedicated stroke specialist who will be joining as a panelist. And we have Dr. Jairaj Pandian, who will join soon. Dr. Jairaj Pandian is professor and head of neurology at CMC Ludhiana. And Dr. Jairaj Pandian is the president-elect of World Stroke Organization. So that is a big achievement. He's the first person from India to be elected as president-elect of World Stroke Organization. So Dr. Jairaj is currently attending the World Stroke Conference in Singapore, and he will join from Singapore soon. We have Dr. Nirmal Surya, who is a consultant neurologist at Bombay Hospital, Mumbai. He is the president of Indian Academy of Neurology. He is a chairman of Epilepsy Foundation, does a lot of social and charity work, and he's a very enthusiastic and dynamic president of Indian Academy of Neurology. Welcome, Dr. Nirmal Surya. We have
Thank you. Thank you, Mr.
We have Dr. Sunil Narayan, who is a professor and head of department at JIPMER Pondicherry. And Dr. Sunil Narayan is presently the chairman of Indian Stroke Association, which is a subsection of Indian Academy of Neurology. Welcome, Dr. Sunil. And we have the moderator for the session, Dr. Brigadier S.P. Gorthi. He is a true brigadier. He has served in the army for many years, and after retirement, he is currently serving at Bharati Vidyapith and Hospital and Research Center, Pune, and he's head of the Department of Neurology there. And he's also the convener of Indian Stroke Section of Indian Academy of Neurology.
Thank you, sir.
So welcome, Dr. S.P. Gorthi. He will
Thank you, sir.
have done a lot of hard work, and he will conduct today's session. We have Dr. Padma Srivastav, who is head of the Department of Neurology at All India Institute of Medical Sciences. Dr. Padma is the Government of India awarded her Padma Shri to recognize her work and her research work and the clinical work in the field of stroke. Welcome, Dr. Padma. We have Dr. Deepak Arjundas from Chennai. Dr. Deepak and his illustrious father, Dr. G. Arjundas. They are a very well-known people, not only in Chennai or South India, but all over the country. Dr. Deepak is not only a stroke specialist, but he has a lot of other interests, and he's a very good clinical neurologist. Dr. Deepak was secretary and then president of Indian Stroke Association. Welcome, Dr. Deepak. We have Dr. Arvind Sharma, who is director of World Stroke Organization, and he will also join from Singapore. He's presently a stroke specialist at Ahmedabad. We have Dr. Partha Ray, from Liverpool, England, and he's a consultant neurologist, very active clinician, educator, and he has a lot of interest in public education as well. Welcome, Dr. Partha Ray. And we have Dr. Swati Bhise from Pune. Welcome, Dr. Swati.
Thank you,
I would, Dr. Jairaj Pandian will join soon. And whenever he joins, then we'll listen to him. In the meantime, I request Dr. Nirmal Surya to say a few words on this occasion of World Stroke Day. Dr. Nirmal Surya. डॉक्टर सूर्या, आपसे गुजारिश है, हम आपको स्वागत करते हैं और आपसे गुजारिश है आज वर्ल्ड स्ट्रोक दिन के उपलक्ष्य में आप कुछ जो हमारे श्रोता है उनको संबोधित करें। डॉक्टर निर्मल सूर्या।
He is muted, I think. Yeah, that's it.
So I think.
Yeah, Dr. Nirmal, please go on. Okay, by the time Nirmal joins, Dr. Sunil Narayan would like to say a few words.
Yeah, thank you. This is the most important day in the diary of all of us who are keenly interested in taking care of stroke patients. And on this World Stroke Day, my warm greetings from the Stroke Subsection of Indian Academy of Neurology. Thank you, Dr. Meshram, Dr. Nirmal, Dr. My convener of the Stroke Subsection, Dr. Goti, and also the esteemed panelists of today's important panel discussion. I wouldn't want to stay long between these discussions with the panelists, but it's suffice to say that from the days of aspirin and reluctant and half-hearted physiotherapy, stroke care has moved in leaps and bounds, and we have now a vast array of treatment modalities like thrombolysis, thrombectomy, and very efficient physiotherapy. But in the core of all this lies, very importantly, the patient education, and very correctly, the 2022 World Stroke Organization campaign has taken it to continue to give importance to learning the science of stroke so that an early recognition, even in minutes, can save lives, save mobility, and save memory. And this is important for people of all the walks of life, because strokes affects everybody. And even especially in developing countries, the burden of stroke, as you know, is even more important nowadays than that in the developed countries. So the stroke, along with this early recognition of the science, it's time that we, in the motivation of people's understanding of the urgency, the message that stroke can be treated effectively, and you must know the stroke centers which are nearby, to whom you have to move the patient to get the correct treatment within the correct windows of time. And this message of learning the science, as well as learning the importance of stroke as a disease, and learning the importance of that, learning that effective treatments are available and where it is available in the neighborhood is extremely important. And we must all work towards this. And we are all working, but it's such a huge problem. And even if we are not having access to the most modern of therapies, just spreading this message or recognizing the science, recognizing the fact that treatments are available and where it is available, can take a long way to provide continue to provide more and more better degrees of treatment for stroke patients so that the burden of stroke can be reduced. I would now hand over. I think Dr. Nirmal has already come in.
Yeah. Can you hear me?
Yes, please go ahead.
Thank you.
Thank you, Dr. Sunil. Thank you, Dr. Nirmal.
सबसे पहले तो चंद्रशेखर मेश्राम जी, आपको मैं बधाई देना चाहता हूं, क्योंकि आप भारत से प्रथम वो व्यक्ति है जो वर्ल्ड फेडरेशन न्यूरोलॉजी के ट्रस्टी के रूप में इलेक्टेड हुए हैं, और ये पूरे भारत के लिए बड़ी गर्व की बात है। आपने पिछले कई सालों से जो एक कैंपेन चलाया है पब्लिक अवेयरनेस का, उसका रंग पूरे विश्व में जो छा गया है, वो आपकी इस जीत में बड़ी अच्छी तरह से दिखाई दे रहा है। So I compliment you, congratulate you, and I am looking forward to have this continuous activity of public awareness throughout the year. Though I may not be the president after next week, but this activity must continue, and I'm sure the incoming president, Dr. Gagandeep Singh, will continue to have trust and faith in you because of your ability to reach out to the masses. Today's World Stroke Day, we got wonderful panel, and I'm extremely happy that beside you, Dr. Jairaj Pandian has been elected as president-elect, who eventually is going to be president of World Stroke Organization. So India is shining, but we need to work hard on stroke. As you know that there is a most common cause of disability of neurological disorder, and it is the duty of each neurologist to create an awareness about the stroke. We all are creating awareness about early thrombolysis, early treatment. We also need to equally stress upon early rehabilitation and the long-term rehabilitation, which has to be part of the treatment to make those 1/3 of the patient who remain disabled. So with that note, you got a wonderful panelist, and I request Dr. Gorti and Meshram to take it forward for the people to remain aware about how to prevent stroke and how, if it comes, how to treat it short term and long term. With that note, thank you all for having supported me throughout the year. Thank you, Dr. Meshram, and thank you, Dr. Padma and whole team. Thank you.
Thank you, Dr. Nirmal Surya, for those kind words. As you know, the stroke is the second commonest cause of death in the world, and neurological diseases are the #1 cause of disability, and stroke is important cause of that. So with this note, I will now hand over to Dr. Gorti, who has done a lot of hard work to take the panel further and educate you about the various issues about stroke. Dr. Gorti, please.
Thank you, sir. Thank you. And in this public education program, and before I hand over to the panelists to set the tone for the coming discussions, I would like to have a few slides about the stroke and what is it to, before I give it to Dr. Padma. And this awareness is very important. And what is stroke is it when the blood supply to a part of the brain is cut off. Without the blood, brain cells can be damaged or die. This damage can have different effects depending on where it happens in the brain. And it can affect people's body, mobility, and speech, as well as how they think and feel. It is very important for us to recognize stroke symptoms and get them to the nearest facility where effective treatments are available. To make the lay public knowledgeable about, we should know that cerebral neurons are very fully dependent on blood. Blood clots block the blood vessels and deprive the brain of oxygen and glucose. And wherever the clot is there, and that particular area is going to die within 10 seconds to 2 minutes, because the stores of oxygen and glucose are only lasting that much time. So these are the small blood vessels one can see supplying the brain. Each area of the brain has specific function. So as stated earlier, most frequent major neurological diseases, stroke 15 million per year. Second most common cause of death worldwide, higher mortality than most forms of the cancer. The leading cause of long-term disability. Early recognition and diagnosis are key targets for stroke management. That's why this awareness is very important. As I said earlier, a stroke occurs when blood flow to the brain is interrupted by a blocked blood vessel or a burst blood vessel. So there will be two types of strokes mainly. When the brain is deprived of blood flow, neurons die within minutes, and you will be surprised to know that every minute, if stroke is untreated, there will be a loss of 1.9 million neurons, and the individual ages by about 3.6 years of a normal aging. So you can understand the gravity if it is more than 1 hour, 2 hours, 3 hours, and how the individual is going to be deprived of his life. So the goal is to take reverse and rescue the ischemic brain and prevent the function. So there is limited time window for intervention, which Dr. Padma is going to tell us, and there is ongoing ischemic damage that's happening, which we have to prevent. This damage, because it's often permanent and irreversible, associated with high morbidity and mortality. So we need to act quickly and efficiently. For that, we should know how to recognize stroke fast. And the campaign of FAST and Be Fast are going to be described. So as I said, there is a hemorrhage, subarachnoid is bleeding around the brain, bleeding within the brain is also called, but the major chunk is ischemic stroke because of blood clots, which have predisposed to by many risk factors. And this panel discussion will be mainly on prevention of stroke. Prevention is better than cure. So if you look at the stroke survivors, the living independently at home are only 25%. Most of them die within 6 months. In long-term care, about 12.5, and at home, but requiring help is on 12.5. So as Dr. Nirmal Surya stressed, it's very important for neurorehabilitation. So we have the stroke survivors have to up again after stroke, and that is going to be dealt by Dr. Swati in the panel. So the stroke is a devastating problem. It's a leading cause of disability. There are about 17 million strokes a day, 6.5 million deaths, and 26 million survivors are there. It can happen to anyone at any age. It affects everyone, survivors, family and friends, workplaces and communities. With this, I would like Dr. Padma to tell us about the very important things, precious time concept, how to save minutes, save lives, the campaign, and what are the 6 key facts about stroke treatment, about recognition of the stroke, and what is the clot busting drugs, what are the clot retrieval treatments, a bit about rehabilitation. There are 6 important facts, key facts, which Dr. Padma is going to tell us. May I request Dr. Padma to take over, please?
Thank you. Thank you, Professor Gorti. And before I start, greetings to Professor Prasad, sir. I've seen that he's joined. He's my teacher. So you've asked about this concept of time is brain. And as I understand, this is a public awareness program. So we will keep the scientific terms to the minimal. Now, I suppose that brain is a supercomputer and nothing really works in life. So we are alive, we can be alive, but without brain, we're probably just vegetables. So, and this aspect, that brain needs to have a nourishment every single nanosecond because there is no store. So the blood supply by the myriads of tiny vasculatures which supply, it's like a huge banyan tree which branches, and depending upon which part of that tree, a big trunk or little branches, get occluded, then that part of the brain which is supplied by that particular blood vessel fades away in minutes. And that exactly is what is meant by time is brain, because every single second which elapses when a clot clogs an artery or the supply and it remains clogged, that brain dries. So essentially, the most, the significant part here to drive home is that we do have different varieties of brain attacks, as Professor Gorti said. One, with the blood vessel rupture, so you're bleeding in the brain, or what Professor Prasad used to teach us, that when the tap is open and there's a leaking tap. Whereas the other is where, the blood vessel is blocked, or, the tap is blocked because it's choked. And that is the commonest. Nearly 75 to 80% of all strokes are those ones. And that's why we're stressing the importance of what we call as an ischemic stroke, and where there is a stoppage of blood supply because there is a clot in the artery. Now, therefore, when you say the minutes as such, and that part of an eloquent part of the brain, now you imagine that when I'm talking to you, I have formulated my words. I want to know what to speak. I'm using my hands. I'm looking at you. And I can see you, all these special senses, my movements, my judgment, my memory, what I am is my brain. So every part of the brain is eloquent in the sense that unless it survives, that functionality will be lost. So a lot of it, which we take for granted in our day-to-day, walk of life, when it is lost, we realize. So when this part of the brain is damaged, then that function will go. So that is the reason that when the minutes elapse, then we become dependent because our speech is lost, our mobility is lost, and we lose our memory, we lose our cognition, we lose the brain. Hence, I guess there is, you can't overemphasize this fact that time matters. Though we are trying to design by research methods as to how to salvage this brain, irrespective of what time the patient is coming to you, because we know for various reasons, sometimes you don't reach in time to the right place. But that apart, time still is a mandatory vertical on which all our acute treatment strategies are based in terms of unclogging this clogged artery, in terms of giving an intravenous technique of methods, what we call as clot busting agents, or in terms of removing the clot by using wires and other contraptions of very sophisticated and very elegant medical infrastructure, which has grown now, and which has become adaptable and available and accessible and affordable to very many. You see, the mandate of all of us who are sitting here as panelists, who are implementers or policymakers, is the same thing, that an optimal care has to be given. It has to be accessible, available, and affordable, irrespective of the social, economic, and geographic barriers. And especially when we have a huge country like ours, awareness about these aspects becomes the first real step. Prevention, but as we're preventing strokes happen because the statistics are so humongous. Every 20 seconds is a stroke, every 2 minutes there's a stroke death. Therefore, we realize that time is brain. Recognize, reach out in emergency, and go to the right place for the right treatment. That is the bottom line. So the key facts essentially, therefore, is recognition. You should know how to recognize. So there are various mnemonics. BFAST is what we generally use, but the FAST as such has gone on universally. You have a lot of campaigns. You have FAST Heroes campaign, which is actually given to kindergarten level. That way. And FAST is probably more comprehensive way of B stands for balance, E for vision, F for face or any asymmetry in the face, A is arm, where when you raise both arms, one arm falls down, S is speech, and T is again driving home the mandatory requirement of time is brain. So BFAST has been translated through vernacularly to different languages across the country, and it is being adopted. And we were discussing just before the panel that how today region-specific and impactful stroke awareness programs are being done, which just shows and drives home the point, the increasing awareness, which is a very welcome gesture. So the key facts, therefore, are know that stroke is happening all around us. It can happen to anyone, to us, to our loved ones. Recognize a stroke, reach out as an emergency. Please don't ignore these sudden onset of functional disabilities. And you should be aware that right treatment at the right time can salvage the brain. Stroke need not kill. Stroke need not disable. Therefore, this is another fact that one should know. And most important is that this is a huge advances so that previous nihilism should go, should get annihilated. There's a lot of hope and aggression. And as we discuss further, we will also look at how even a disabled person can be integrated back as a useful member into the society. So I think that's what it is, that we have clot-busting drugs, very good chance of a recovery if given in time. And we also have, beyond this, mechanical thrombectomy. Please look at a parallel of how a heart attack is managed. We are around the same time. Clot vessel in the heart, management, you know it's an emergency. Just draw a parallel to the brain. It is the same principle, except the time becomes even more critical here. And rehab, comprehensive. Don't think rehab is just plain exercises or doing some physiotherapy in quotes. No, it is getting this patient back integrated into the independent user member, productive person into the society. That would be the most important thing. So therefore, we know that this is growing, and India is also heading towards a stroke epidemic, whether we have COVID or non-COVID or another COVID, I don't know. I mean, we forget about it. Stroke remains as one of the very important NCDs. So please remember, recognize, reach out in time. Yes.
Thank you, Dr. Padma. And it's indeed, it's a very, very lucid talk by you. But I wanted to stress one point. As compared to myocardial infarction, the rewards of treating stroke early are much more, as brought out in the literature. So it's a very important thing. You recognize the stroke and bring the person to the hospital where it can be provided. Now we'll go on to Dr. Deepak Arjun Das. We'll ask him about the prevention is better than cure. So what are the risk factors which should be taken care so that stroke doesn't happen at all? Stroke is associated with a lot of disability, and it is better to prevent and take care. And early in the life, we address these factors, then we can prevent the stroke. Dr. Deepak, can we have your three most important risk factors: smoking, cholesterol, and blood pressure, for the public, how they should avoid these things and how should they overcome it? Deepak, please.
Welcome all to this important talk on how we can prevent stroke to a certain extent. There are three important factors that have been by the WHO, that is smoking, cholesterol, and high blood pressure. Of course, you need to have a good lifestyle and control your sugar as well. Smoking, there are hundreds of chemicals in the lungs into the bloodstream. These these chemicals can damage the cell in different ways. Affects cholesterol goes down, and the smoking from carbon monoxide reduces the amount of oxygen by your pack cell, your hemoglobin. Concentration will go up. It's like thick getting into small vessels, much higher. What happens? Second, blood pressure goes up. And combination of raised PV, your blood pressure going up, the chance of
Dr. Deepak, you are not audible. Mansi, will you look into this? Hello. Deepak, you are not audible properly.
Can you hear me now?
Yeah.
Can you hear me now?
Yeah.
Gases have become the blood supply inside the stream. Gases is also important in prevention of stroke. non-smokers who live with smokers will have double the risk of having a stroke. It is worth quitting smoking as first once 12 hours, you will find the circulatory system starts to improve. After 1 or 2 years, significantly reduce. How does one quit smoking? Next slide, please. Nicotine is highly addictive substance, and you can know this when you treat smoke.
Deepak, are you there? Not able to listen to you. Mansi, will you check, please? We got some technical hitch. Hello? Yeah.
Can you hear me? This bad
Cholesterol.
builds up on the artery wall and reduces the thickness of the wall. Then what happens is the blood supply distally to the vessel gets obstructed or altered. Is a good cholesterol because it has to carry the bad cholesterol away from your blood cells back to the. How do I know how the cholesterol level is? Next, please. I know the cholesterol level is there. You know, person, if you cholesterol not necessarily so. Way to the cholesterol is high is to do a blood test. Best to do the blood test fasting. It can be done in any lab or in any pharmacies where they have this instant cholesterol check. You for a total cholesterol, look at the HDL and look at the bad cholesterol. That the LDL cholesterol is directly measured and not calculated. In many labs, the LDL cholesterol is calculated, which can give you a wrong number. Triglycerides also have extra fat, which is seen in the blood and is have very bad side effects similar to LDL. Next. Diet. A diet in saturated trans fat will increase the levels of LDL and increase the risk of stroke, heart disease. We all know there are many foods there in Indian diet. Food in the morning, to wake up, have thick milk tea, which is definitely going to boost the cholesterol. Deep fried food, pastries, fatty meat, butter are known to increase your cholesterol. Slide. Reduce your cholesterol. There are a number of ways that you can do to reduce, and this will other things. One simple thing: fiber in diet. Before your lunch and dinner, you're sure your fiber is going to go up, thereby your LDL will come down. Second, omega. We can reduce the LDL and have high omega 3s. Third thing, try to move. Regular physical activity will help to reduce your cholesterol. Reducing weight to a certain extent will also reduce the LDL or smoking is mental and increases LDL. Stopping smoking, smoking with medications for cholesterol, but we know that it has got a lot of side effects and it needs to be taken for weeks or months. The most commonly prescribed medicines for reduce will have severe body pain, immune disturbance on taking cholesterol tablets. Abruptly stop cholesterol tablets because they will make the blood and your chance of re-stroke higher. No. For diabetes. 1 in 5 people who have a stroke are diabetic patients. With diabetic, the high stroke, your outcome of stroke will be poor. Stroke and diabetes share many factors. Most can be addressed with lifestyle changes. Diabetes is when your pancreas stops producing insulin. Diabetes leads to hardening of the vessels. An elastic vessel is very thick. Once a becomes thick, it is liable to get blocked or to rupture. So diabetic patients are prone to multiple small strokes. Many of the people who die of diabetes, when they stroke, have the presentation in the we know that you do not will be hospital and your recovery will be poor at the discharge. And urine the symptoms of type 1 and 2 diabetes. Frequent urination, particularly at night, excessive thirst, feeling fatigue, weight loss, which is not afraid, itching in the genital areas, a wound that take longer to heal, and a blood vision which can be intermittent. Common symptoms of type 1 and type 2 diabetes. As I told you, type 2 diabetes is more common for diabetes, those who are overweight and obese. How is diabetes treated? Next slide. Type 1, type 2 diabetes are lifelong conditions. We have no medications available during this. Type 1 diabetes, on the other hand, can be treated in Some people with type 2 diabetes reduce by controlling their diet, regular exercise, weight loss, and having a healthy life, avoiding alcohol. Diabetes, you should have regular blood checks. You should own a meter at home. Now, electronic meter, which is connected to your iPhone, you don't have to put that small meter over the patch, and your sugar can be identified many times a day. A diabetic can reduce his stroke risk by controlling his blood pressure, controlling his cholesterol, quitting smoking,
Thank you, Dr. Deepak. You have touched upon very important risk factors: the smoking, the cholesterol levels, and the diabetes. These are very, very important. If we can tackle them, and right from the younger age, we can prevent stroke, which has got very devastating follow-ups. So, is Arvind Sharma there? Can I have Dr. Arvind Sharma? He's going to tell us about two important risk factors, that is blood pressure and atrial fibrillation. Dr. Arvind is having a problem in getting connected, so I think I'll deal with these two important risk factors. And high blood pressure affects about half of the people in the world and often has no noticeable symptoms. And unless you check it, you won't find it. Left untreated, it damages the blood vessels and can lead to a number of serious diseases, including stroke. More than half of all the strokes are associated with high blood pressure. A simple blood pressure check can determine whether you have blood pressure which is high, and a health professional can advise on whether your condition can be managed with lifestyle changes and the right medication. It's very, very important to check your blood pressure, especially in patients with diabetes. Blood pressure check is very important. The best thing you can do is check their blood pressure, control them to prevent stroke. How is it diagnosed? There is no other way except to check. And periodic screening after 30 to 40 years is important. When you have a blood pressure check, your health professional will record two numbers known as systolic and diastolic blood pressures. Systolic blood pressure, the higher number, is a measure of the force with which the blood is being pumped around your body. Diastolic pressure is the level of resistance to the blood flow in your body because of atherosclerosis, which is contributed to by smoking, diabetes, and cholesterol. The definition is an elevated blood pressure of 120/80 or above. If your reading is constantly above 140/90, this is called hypertension. How is it related to stroke? Consistently high blood pressure makes your circulatory system, that is your heart, your arteries, your blood vessels, they work harder at their job of moving blood around your body. This extra work causes damage that can make your blood vessels, including those in your brain, harder and narrower over time. This is what I was telling you about atherosclerosis, which increases the risk of blockages in the blood vessels due to blood clots in your brain. The blood supply to an area of brain is cut off or restricted. It can lead to permanent brain damage or death. So atherosclerosis can also increase the pressure, the blood flow through the blood vessels in the brain, causing them to burst and bleed. This is called intracerebral hemorrhage, hemorrhagic stroke, which can also cause permanent damage. So two dangers. So one is ischemic stroke, the other one is blood pressure, IC. What causes high blood pressure is linked to age. If you are age over 65, you are higher risk of elevated blood pressure. If you have a family history of hypertension, you are at more risk. If you're from a Afro-Caribbean or South Asian background, you're at higher risk of blood pressure due to ethnicity. There is a separate category that pregnancy, so pregnant hormonal changes put you at increased risk. and health conditions. Diabetes are likely to have elevated blood pressure. Kidney diseases can be a result of elevated blood pressure. Also, they cause blood pressure. Can also be because of kidney damage. So how are you going to control this? And this is linked to a number of lifestyle factors. Addressing these factors will prevent, and you have to manage your blood pressure by lifestyle modification with exercise. Regular exercise, at least 45 minutes, can help you to manage your blood pressure. 30 minutes of brisk exercise 5 times a week is recommended, at least, to reduce your risk of stroke and other diseases. Being overweight or obese, carrying too much weight, particularly around your middle, puts extra strain on your heart and other organs and increases your risk of high blood pressure. Diabetes, both of which increase your risk of stroke. So something called waist hip ratio, which has to be in a proper proportions. And the processed foods, which contain high levels of salt, fat, and sugar, which all contribute to higher elevated blood pressure as well as increasing your risk of obesity. Eating a healthy diet, high in fruits and vegetables, whole grains, healthy fats, the low salt can help you to prevent and manage hypertension, which will lead to prevention of stroke. More than half the people with elevated high blood pressure also have high cholesterol. Eating a diet which is low in saturated fats and exercise regularly can help to prevent this atherosclerosis. If cholesterol cannot be managed by dietary change, as Deepak was saying, you should resort to cholesterol lowering drugs, which will help reduce your stroke risk. High blood pressure also linked to a number of other lifestyle risk factors, unlike alcohol. Regular and heavy use of alcohol is linked to high blood pressure. Dr. Bardhare is going to talk to us about this. He also has alcohol causes heart rhythm disturbances and it increases your risk of stroke. Avoiding alcohol or sticking to recommended consumption. I don't recommend anything, but it's in the literature that there's no more than 2 units of alcohol a day will reduce your risks. And this is a debatable issue. What is this unit? Dr. Partha is going to tell us. Smoking, as I said already, Dr. Deepak said, temporarily increases your blood pressure, contributes to damaged arteries, high blood pressure, stroke, as well as a range of other diseases. Another important factor is stress. Stress temporarily increases your blood pressure. High levels of stress are experienced on a regular basis. This can damage your arteries over time, and it increases your risk of stroke and other diseases. So stress can also be contributed to behaviors such as poor diet, physical inactivity, excessive alcohol consumption, which will increase your health. And what is the remedy? Remedy is going to be yoga and meditation. And we have to reduce how to handle your stress, you should know. Sometimes other risk factor is called atrial fibrillation, which is very common but unrecognized. There are many causes for atrial fibrillation. What is atrial fibrillation? We should understand. Atrial fibrillation is a condition where the heartbeat is irregular and often very fast. Many people feel it that they have irregular heartbeat. They say palpitation. It's very important to know about atrial fibrillation because if it is left untreated, it is a major risk factor for stroke. Happens whether the blood supply to the part of your brain is cut off because of blood clot, or also when the brain artery ruptures and leads to hemorrhage. But it is a leading cause of death. That's why atrial fibrillation is a major contributor to this. If you have AF or atrial fibrillation, you are 5 times more likely to have a stroke. With regular treatment, right treatment, the risk of AF-related stroke can be reduced. And what is AF? The atrial fibrillation, the 2 chambers of the heart are called atria. They don't beat effectively. As a result, blood doesn't get pumped out properly. If it pools in and can often clots, and the clots will circulate around the body. If these clots travel to the brain and blocks a blood vessel, it can trigger a stroke. So strokes caused by atrial fibrillation are more likely to be fatal or serious disabilities result. Though they are, however, highly preventable. That's why everybody should be aware of this important risk factor. Many people, it is symptomless and often detected by physical examination only or with an ECG. Other people may experience one or more of the following symptoms like general fatigue, rapid and irregular heartbeat, thumping in the chest, dizziness or lightheadedness, shortness of breath, anxiety, weakness, faintness or confusion, fatigue when exercising. So all these things, when reported by an individual, one should carefully look and investigate for atrial fibrillation, and it is caused by, the exact cause is known, but it is seen with diabetes, thyroid overfunctioning, and certain types of lung disorders like asthma and chronic obstructive pulmonary disease are more common in men than women. How is it diagnosed? It is by just checking your pulse, and check pulse, and it should be regular. If it is constantly lower than 60 or higher than 100, you should speak to your doctor about your pulse rate. You may decide to conduct some tests to make the accurate diagnosis. Blood tests may help to identify anemia or hyperthyroidism. ECG is important. Echo will tell you about the structural damage to the heart. And nowadays we have implantable cardiac monitors, which can monitor your heart function up to 7 days to 3 months to 6 months and detect the paroxysmal atrial fibrillation, which is a very, very important cause for strokes. It can be treated with drugs called anticoagulation. If hyperthyroidism is there, the antithyroid drugs can be used. Warfarin is a very important drug to prevent stroke. And once AF is detected and it has been prognosticated with CHAPS-VAS score, which is a tool which we use to predict the severity, the outcome of the atrial fibrillation, then it can be effectively treated. And is there anything one can do to prevent? Yes, there are many things which you can, because this is a more important factor about 60 years and afterwards. Manage your weight. Being overweight is a risk factor for AF and contributes to diabetes, hypertension, and sleep apnea, and all of which increase your AF risk. Reduce the fat in your diet. Stick to recommended levels of alcohol consumption. Avoid stimulant drugs like cocaine, etc. And excessive caffeine also is important. So then more information can be obtained in the sites. So I think with this important risk factor, I'll ask Dr. Parthe Ray to join us and tell us about alcohol and diet, and another two important risk factors which will definitely prevent stroke. And okay, Dr. Parthe, you can manage your slides and please go ahead. Dr. Parthe, are you having any problem?
So can you unmute yourself? So Dr. Ray.
Please unmute yourself.
What
Dr.
about now? Can you hear me?
Yeah, it's okay.
Acha. Sorry for that. Yeah. Okay. Right. हाँ. नमस्कार, सबको नमस्कार. मैं हिंदी में ज़्यादा से ज़्यादा बोलूँगा क्योंकि हमारा पब्लिक अवेयरनेस प्रोग्राम है और अंग्रेजी में सिर्फ कुछ टेक्निकल टर्म्स है जो हम जनसाधारण तक पहुंचा नहीं पाते हैं, लेकिन हिंदी में बात करने से हम सोचते हैं कि हमारा जो नागरिक हैं वो हमारा संदेश ज़्यादा से ज़्यादा ले सकेंगे. मैं इंडियन एकेडमी ऑफ न्यूरोलॉजी को धन्यवाद दे रहा हूं कि मुझे आप इनवाइट किए हैं. सीनियर मेंबर्स को मेरा प्रणाम. तो स्ट्रोक बहुत खराब बीमारी है. मैं ये बोल के शुरू कर रहा हूं क्योंकि जिसको बड़ा स्ट्रोक हो जाता है उसका जीवन पूरा अलग हो जाता है पहले से. और मुझे 2 टॉपिक दिया गया है डॉक्टर गोरथी साहब जो बहुत महत्वपूर्ण है क्योंकि इन दोनों को हम अपने कंट्रोल में रख सकते हैं. इसको हम चेंज कर सकते हैं, बदल सकते हैं ताकि हमारा नुकसान कम पहुंचे. बहुत कुछ चर्चा हो गया है, गोरथी साहब बोले हैं, अर्जुन दास साहब बोले हैं, लेकिन अल्कोहल जो है हमारा ये बहुत बढ़ गया है. हमारा देश में लास्ट 20 साल में करीब 72% अल्कोहल का कंजम्पशन या पीना बढ़ गया है. यह है OECD फिगर्स और इससे बहुत नुकसान पहुंच रहा है. हम जो पहले दूसरा लाइफस्टाइल था हमारा इन भारतीयों का, खाना पीना, सोशल स्ट्रक्चर, ये सब पिछले 20 या 30 साल से मैं देख रहा हूँ दूर से कितना बदल गया है। और स्ट्रोक का नंबर्स भी बढ़ते जा रहा है और हम बहुत ज्यादा साल जी भी रहे हैं। मेल जेंडर और उम्र को तो कोई बदल नहीं सकता, लेकिन अल्कोहल और डाइट, खाना पीना, ये दोनों तो हमारा हाथ में है। इसीलिए मैं चाहता हूं कि हमारा आम नागरिक इस पे कंट्रोल लगाए। ये ब्लड प्रेशर बढ़ा देता है, ये बात हो चुका है। एट्रियल फिब्रिलेशन माने कि दिल का धड़कन बढ़ जाता है, क्लॉट बनता है हार्ट के अंदर, ये क्लॉट ब्रेन का आर्टरी में जा करके ब्लॉक कर देता है, ये सब सुने हैं। इसके लिए जो दवाई दिया जाता है वारफरिन, और बहुत सारे दवाई से अल्कोहल का इंटरैक्शन होता है। डायबिटीज में हम जानते हैं कि कैलोरी या कितना हम खाना खाते हैं, एक्सरसाइज करते हैं, इंसुलिन बॉडी से निकालता है, इसका तीनों का तुलना में डायबिटीज कंट्रोल रहता है। और जब नहीं कंट्रोल रहता है तो जो छोटे छोटे ब्लड वेसल है ब्रेन के अंदर, उसमें नुकसान पहुंचता है। अल्कोहल में बहुत सारा कैलोरी रहता है, हम जानते भी नहीं, पीते रहते हैं, इससे वजन बढ़ते जाता है। और एक्सरसाइज तो हम आजकल के दिन में बहुत कम करते हैं पहले जैसा, क्योंकि मोटर कार है, सेडेंटरी लाइफस्टाइल हम बोलते हैं, हमारा एटीट्यूड भी बदल गया है। टेलीविजन, स्क्रीन, ये सब बहुत बच्चों में भी आ रहा है, हम जो बूढ़े होते जा रहे हैं उनमें भी आ रहा है। और लिवर डैमेज तो बहुत बहुत अल्कोहल से डायरेक्टली लिंक है, क्योंकि अल्कोहल में जो केमिकल रहता है वो तो शरीर के अंदर जाकर के बहुत सारा टॉक्सिक केमिकल बन जाता है, और उसको शरीर से निकालने में लिवर, ब्रेन, नर्व्स, हार्ट में भी, मायोकार्डियम पे, हार्ट का जो मसल है उसमें भी असर पड़ता है। इसीलिए मेरा तो आइडिया है कि अल्कोहल को ज्यादा से ज्यादा छोड़ना चाहिए जो पी रहे हैं, कि बहुत बहुत कम, क्योंकि हम इंग्लैंड में सुनते हैं कि वो स्पेशल ओकेजन में, क्रिसमस, वेडिंग, बर्थडे में सिर्फ पीते हैं, सोशल ड्रिंक है। लेकिन हमारा अल्कोहल इंडियन सेटिंग में तो हम हमारा खाने के साथ तो पीते नहीं, लेकिन टेबल वाइन यहाँ पे जो 4% या 10% पीते हैं, ये इनका डाइट का पार्ट है। ये जेनेटिकली इनका मेटाबॉलिज्म या अल्कोहल को तोड़ करके ठीक करना, उनका जेनेटिक प्रोफाइल भी अलग सा है। लेकिन हमारा देश में हम बहुत सारा अल्कोहल पी रहे हैं। गोरसी साहब बोले हैं कि अल्कोहल का यूनिट्स जो है, 2 यूनिट फॉर 1 मैन एंड 1 यूनिट फॉर अल्कोहल फॉर वुमेन, अभी इंग्लैंड में तो 14 यूनिट्स पर वीक ये अक्रॉस द बोर्ड हो गया है। लेकिन ये सब वेस्टर्न डेटा हम देख रहे हैं, और इसको हम इंडियन सेटिंग नागरिकों के लिए बोल रहे हैं। शायद ये फिगर एक नहीं हो सकता है, क्योंकि हमारा जीन जो है, मेटाबॉलिज्म जो है, ये अलग सा हो सकता है। और एक तो प्रॉब्लम जो है कि हम बहुत सारे डिफरेंट अलग अलग किस्म का वाइन, बियर, स्पिरिट, जिन, वोडका, बहुत सारे टाइप्स ऑफ अल्कोहल आ गया है इंडियन मार्केट में पिछले 20 या 30 साल में। लेकिन हमारा साधारण नागरिक जो ये पी रहे हैं, ये तो एडुकेशन नहीं मिला है कि कौन क्या है, कितना परसेंटेज रहता है। गवर्नमेंट से भी उतना एजुकेशनल प्रोग्राम नहीं है। सिगरेट स्मोकिंग में है सनीमा में बहुत दिन से, लेकिन अल्कोहल इंजूरियस टू हेल्थ, ये भी ज्यादा से ज्यादा बोलना चाहिए। लिवर डिजीज सर्जन जो है, फिजिशियन जो है, वो ऑलरेडी बोल रहे हैं। तो मेरा तो धारणा ऐसा है कि अल्कोहल जो पी रहे हैं वो इसको कम कैसे किया जाए उसका प्रयत्न करें और कम करें। और बात है कि पानी के साथ पिए, धीरे धीरे कम करें। और जो कम उम्र में अल्कोहल का पीना आदत हो गए हैं, वो ट्राई करें कि कैसे अल्कोहल फ्री डे करें, नॉन अल्कोहल या लोअर परसेंटेज अल्कोहल, जैसा कि जो वोडका, विस्की, स्पिरिट्स पीते थे, वो धीरे धीरे कैसे टेबल वाइन 4% और नाप के पीना पड़ेगा। और बिंज ड्रिंकिंग के एक साथ पार्टी में पीयर प्रेशर, दोस्त बोल रहे हैं अल्कोहल नहीं पिएंगे, ये बोलने का आदत बनना चाहिए धीरे धीरे। से नो टू अल्कोहल, डोंट स्टार्ट इफ यूर 40 and 50 if you're feeling lonely। अकेला लग रहा है, एक ग्लास बियर पी लो। क्या होगा, बताया गया है कि अल्कोहल से बहुत कुछ नुकसान आएगा और अंत में स्ट्रोक होगा। एक बार स्ट्रोक हो गया तो बहुत झंझट में नागरिक पड़ जाएंगे, इसलिए कटिंग डाउन सबसे बड़ा चीज है। अच्छा, सिर्फ टाइम कम है, इसीलिए मैं दूसरा सेकंड सेगमेंट में चला जाऊंगा जहां पे डाइट है। गोटी साहब मेरा स्लाइड मूव नहीं कर पा रहा है। डाइट जो है, डाइट, थैंक यू। हाँ, तो डाइट, खाना जो है, ये भी हमारा हाथ में है, इसीलिए बहुत कंट्रोल में है, क्योंकि यू आर व्हाट यू ईट, ब्रिटिश लोग बोलते हैं। इसीलिए हम क्या खाएंगे ये तो हमारा हाथ में है। और खाना ठीक नहीं लेंगे तो स्ट्रोक का संभावना बढ़ जाता है। नमक, शक्कर, फैट, ये सब हम सभी जानते हैं, लेकिन इससे टेस्ट भी अच्छा होता है, इसीलिए हम खाते हैं। लेकिन टेस्ट हैबिट है, टेस्ट को हम बदल सकते हैं। एडुकेशनल अवेयरनेस जो है, ये जब बढ़ेगा तब पब्लिक, हम सब नमक, शक्कर, फैट कम खाते रहेंगे। मेडिटेरियन फैट है, मेडिटेरियन डाइट है, ये हमारा जो इंडियन जो डाइट है, जो प्लांट बेस्ड था, वेजिटेरियन डाइट था, ये सब बहुत अच्छा था। लेकिन अभी ये फास्ट फूड का जमाना आ गया है, फैशनेबल हो गया है ये पास्ता, बर्गर, पिज्जा, ये सब खाना। ये सब खाने से बहुत धीरे धीरे बॉडी में कोलेस्ट्रॉल जमता है और ब्लड वेसल धीरे धीरे नैरो हो जाता है, खून कम जाता है। इसीलिए डाइट पे बहुत नजर देना चाहिए। फ्रूट्स, वेजिटेबल्स, हमारा कंजम्पशन कम है क्योंकि कल्चर नहीं है। हम सोचते हैं कि जैसे कि कंट्री इकोनॉमिकली प्रॉस्पर कर रहा है, हम रिच होते जा रहे हैं, तो मांस ज्यादा खाते हैं, मीट खाते हैं, रेड मीट खाते हैं। रेड मीट नहीं खाना चाहिए, इससे फिश जो होता है, जो हमारा नेचुरल डाइट होता है, वो अच्छा है। वेजिटेबल्स और फ्रूट का हैबिट जो है, ये साधारण जो आदमी है वो उतना नहीं लेता है, दाम भी ज्यादा होता है इसीलिए। और पीनट्स, लेगुम्स, पीस, जो दाल जो है, ये सब ज्यादा से ज्यादा खाना चाहिए। ये सब इंटरनेट में है, हमारे सबके पास अभी स्मार्टफोन है, हम देख ही सकते हैं कि डाइट कितना है। कैलोरी काउंट करना चाहिए। जब सुपरमार्केट में आप जाते हैं तो एक बार देख लीजिए कि क्या क्या खाना रहता है उसमें। इसीलिए क्या क्या खाना बंद करना है, हम बोले हैं शक्कर, नमक, ये कम कर दीजिए, इससे आप अच्छा रहेंगे। और हम कुछ चार्ट बनाए हैं, बाद में आप देख पाएंगे कि क्या क्या खाना उचित है और क्या क्या खाना, कम खाना, ये बंद कर देना उचित है। तो अल्कोहल और डाइट आपका हाथ पे है, आप चुन के खाइए। कभी कभी कुछ रिलैक्सेशन मोड में साल में 1-2 बार अल्कोहल पी लीजिए नाप के, और जो पी रहे हैं कम कर दीजिए, क्योंकि अल्कोहल बहुत शरीर में नुकसान पहुंचाता है। हाँ, गवर्नमेंट को एक्साइज ड्यूटी जरूर मिलता है, लेकिन हमारा शरीर तो खराब होते जा रहा है। ये बोल के मैं खत्म कर रहा हूँ। ये दोनों बहुत महत्वपूर्ण फैक्टर है जिससे हम स्ट्रोक को कम कर सकते हैं और हम सब अच्छा रहेंगे, यही हमारा वादा है। इंडियन
बहुत बहुत
अकेडमी ऑफ
शुक्रिया
न्यूरोलॉजी
डॉक्टर
जिंदाबाद।
पार्था। डॉक्टर पार्था, बहुत बहुत शुक्रिया, आपने बहुत बढ़िया हिंदी में बात किया है। दो मैं साउथ इंडियन, आई कैन अंडरस्टैंड, एंड द मेन issue as you raised is common people should understand। सबको ये पता होना चाहिए कि हम क्या बोल रहे हैं। थोड़ा साइंस, जैसे डॉक्टर पद्मा ने बताया, कम, और आपने बहुत अच्छी तरह से हमने एक्सप्लेन किया, जो वेरी वेरी इंपॉर्टेंट। सो नाउ वील गो टू द अदर इंपॉर्टेंट रिस्क फैक्टर्स व्हिच डॉक्टर स्वाति Vishay is going to do about exercise and stroke and body weight. Dr. Swati, are you there?
Yes, sir. Hello, sir.
Yeah.
Yes, sir. Good evening, everyone. Thank you for all members of Indian Academy of Neurology. Thank you, Gothi sir, for giving this opportunity to speak here. I will be taking, as a physiotherapist, we actually deal with the physical fitness, and physical activity is a part of exercise. That is, physical activity plays an important role in prevention and treatment of multiple chronic diseases, health conditions, and their associated risk factors. It helps in prevention of many mainly cardiovascular diseases and also for the stroke. As discussed by all panelists, these are the different measures for the stroke prevention. That is, exercise is one of the important part of that. Exercises help in prevention of regular fitness activity that can inverse the pre-mortality rate, cardiovascular diseases, chronic coronary artery diseases, and other primary and secondary risk factors. It actually helps in reducing heart rate, decreasing BP, then decreasing cardiovascular diseases risk factor, decreasing the systolic and diastolic BP, decreases fat, total and absolute abdominal fat component. It decreases insulin need and increases glucose tolerance. It also helps in decreasing platelet adherence and aggregation, and it improves the higher activity level and fitness level. There are majorly health-related physical fitness component, which include as a physiotherapist, we do take care of cardiorespiratory endurance, body composition, muscular strength, muscular endurance, and flexibility component. And even there are few components, that is skill-related physical fitness component, which include agility, coordination, balance, power, reaction time, and speed. As directed by American College of Sports Medicine, these are the fit protocol which we all should follow. That there are regular exercises that regular exercises like walking and rhythmic activity can be performed 3 to 5 days per week. That helps. Means 20 minutes of exercise per day can help in reducing the prevention of the stroke. And again, depend on the personality, the exercises can be go in a moderate and the vigorous level. Regular exercises which are suitable and minimal skill levels are required. That includes walking, cycling, then aquatherapy, then aerobics, and slow dancing. Then obesity. Again, obesity plays an important role. Obesity and overweight becomes a risk factor in a stroke patient. That again, obesity doesn't have a direct role related to the risk of the stroke, but it helps. It is one of the measurable risk factor, which directly includes the mechanism of increasing the diabetes, hypertension, accelerated atherosclerosis, atrial fibrillation, and obstructive sleep apnea. The end result of obesity, that is, it results into progressive atherosclerosis or thromboembolism, and that may result in the arterial occlusion and the rupture. BMI, that is body mass index. Generally, as a body mass index, it is measured, that is weight in kgs divided by the height in meters. The overweight and the obese, when the BMI falls into 25.0 to 29 to 34.19. Obesity management help to reduce the risk factors of the stroke patient, and obesity can be measured by BMI, that is body mass index, also by the waist circumference, waist hip ratio. That is one of the parameters which can be checked in the obesity. then sustained weight loss, that is around 3 to 5%, is likely to result in clinically meaningful reduction of cardiovascular diseases, which help to include in decreasing the triglyceride, blood glucose level, then HbA1c levels, and also risk of developing type 2 developing. It also, there is a evidence of little 2 to 3% loss can result in reducing or improving the cardiovascular risk factors. According to ACSM guideline, the activities, that is physical activity less than 150 minutes per week, help to promote the minimum weight loss, and the activity which is more than 150 minutes per week will result in moderate level of weight loss 2 to 3 kg, and more than 225 to 420 minutes activity per week will help to reduction in the 5 to 7 kg weight loss. Again, with weight loss, there are chances of weight gaining occur again. So maintenance of weight loss can be done by doing a physical activity of around 150 minutes per week is advisable to maintain the weight loss. So these are the different factors that it increases exercises which help to reduce in overall fat level. It improves the alertness, it improves the glucose level, it decreases the insulin level, and it increases the energy and fitness level. So these are the different activities by which the these are the fitness, exercise, and obesity can help to prevent the stroke. Thank you, sir.
Thank you, Dr. Swati, and it's indeed a pleasure to listen to you about exercise and the overweight part of the prevention strategies that are there for stroke prevention. And now, we have observed all the stroke risk factors prevented. Some people may not adhere to these rules, and if they suffer from stroke, Padma is going to tell us about re-emphasizes that need for treatments and some more light on treatment, and she's going to tell us about stroke riskometer and what is it and how to use it.
So let me start with, in fact, riskometer more than stroke treatment, since we've actually talked that there is a treatment available and you actually need to be at the right time to get that treatment. If we can come to riskometer, Professor Gorti, because that is something which these guys will know. The stroke treatment part has been already covered, the clot lysing drug and the mechanical ways of removing the clot. I will touch upon it a little bit. Now, you see, the thing is that we use apps. And if there is, in fact, there are always these buzzwords in the universe which keep popping up. There was a buzzword called nano at one time. Then now we have the artificial intelligence, machine learning, and we have the apps. So the app is essentially an IT-based technology, which I think most of the non-medical people who are connected to this online program will immediately connect, is that we do have these apps into our smartphones, which tell you a lot of things. So we have a Google map, which will tell you about your direction. And we have all the shopping apps, which are there, and entertainment apps. So the best way, one of the ways to connect, and this is a part of a social media connect, is to develop an app, which if it can tell you what is your personal risk to develop a stroke. And there are certain parameters in it, like, what is your age? What is your gender? Do you have blood pressure? Do you have, a bad blood sugar control? Do you smoke? Do you drink at a particular time? What is your exercise time? What is your body weight? So, there is a calculation for your body mass index. So looking at in that, then it will quickly tell you what is the risk of you developing a heart attack, a stroke, so on. So essentially, when I have an app downloaded into my smartphone and I put in my age, my gender, I mean, whether I have a BP problem, do I smoke now, and all that, and it'll tell you what is your risk. Are you 10 times the risk? You're not at a risk? So if you have a risk which comes in, it pops up, it's in your face. Oh my God, I'm at a risk. I'm 10 times the risk of developing a brain attack. So it will quickly tell you, it'll red flag the probability, and it is a personalized kind of a risk. And then it'll also tell you, okay, now you decrease your BP, you decrease your blood sugar, you decrease your this, your BMI is reduced, then your risk is gone down. So it is a great incentive for you. So at the end of say 2 weeks, you've done this, and the risk is coming down. It is an amazing incentive for one's own self. Oh, now I've reduced the risk, and then it'll give you that impetus. So this has been a major kind of an incentive. There have been a lot of stroke riskometers which have been validated, which have been published. And a lot of riskometers are in fact very expensive. Okay. So there's been an India-centric mechanism and an exercise where similar apps have been developed which are of no cost. But let me tell you a behavioral problem here. Professor Gurti, I think this is for all of us, the behavior issue. Now, when we developed such a similar app in Himachal, I mean, the team which developed this and said, okay, you don't have to buy the world stroke riskometers, which are very expensive. Please download this very simple stroke app, which is no cost for you. And then we had seen that people will download a Myntra app, will develop a Shoppers Stoppers app, but they will not download this free stroke riskometer app. So you see, that is the behavior change. We will give you this public awareness programs, and we'll tell you, ki, acha, don't smoke, don't drink, don't do this, don't do that, you sleep well, what you eat or what you are, what not, and give you the science behind it. But the behavior change is something which we still do not know, that kind of a switch, how to make people actually, not just listen, but digest and implement what is being done. So riskometer's story is very, very been successful across the world, but we are trying to develop our own geographic centric, and which is accessible. And again, I'm coming back to the same point of being affordable. Therein, I'll bring in my 2 points about the stroke treatment, as Professor Gurti wanted me to talk about. Yes, what science has given us, there is no clinical equipoise in any of the science that we have now. Stroke, ischemic stroke can be treated. You don't have to suffer any disability. In time, the clot can be taken out, giving by a very simple intravenous technique of clot busting drug. Freely available, we have 2 drugs available with us, both alteplase and tenecteplase. Tenecteplase is a generic form, which is again an indigenous product. Very, we are very proud of what we actually produce from our own country. And both these are being extensively used. And at some point when the clot is a major burden, it's a big artery, then we do have contraptions of going in and taking it out. And that is what is called as a mechanical thrombectomy. Both of them are there, well established, what we call it as a grade A recommendation. The only trick is, please come to us in time. The rest of it is from the door. Once you enter, then it is our responsibility how you manage it. And we also, kind of update ourselves, don't lose with our paramedical staff, with our emergency staff. I know each one of us sitting on the panel, we are in this exercise every single time. We reiterate that we also don't lose time once you come in. There's a famous, a quote by one of the very aggressive strokeologists in the world. Dr. Michael Kiel. This is one of the stroke editorial. It says, the mandate of all of us sitting in this panel, the reason we're talking to you is that mandate is, when a stroke victim
Yeah, now
Hello?
it's back. It's back now.
Yeah, I think it went away. Okay, so I'll just say that, and I'll stop here since I think we're running out of time. There's just one statement that Dr. Hill had actually said that, when our mandate is when a stroke victim is wheeled in, okay, on a stretcher or wheeled into the emergency, the mandate is he walks out of the hospital back into his life. Such a powerful statement. That's exactly what this whole thing is, that kind of a treatment is available. Please reach us in time and prevent the stroke. Try and get one of these apps onto your smartphones. It'll tell you the risk and how to reduce the risk as well.
Thank you, Dr. Padma. I think two important things you stressed. One is to adhere to stroke riskometer and assess your risk. The second one is be fast, and you have to recognize stroke symptoms, and that awareness should come in the public. Everybody should recognize what is stroke, and then only they can get the patient to, because even now many of the medical fraternity itself, they don't know what to do with stroke, and it happens every day with us. So I think this awareness program is very important. We'll go on to next is Dr. Deepak Arjundas is going to tell us about action for the prevention of stroke, action to be taken at individual level, action to be taken at healthcare providers, action to be taken by government. And Dr. Deepak, will you please summarize all the risk factors if you can once again, because that's the most important is to prevent than to treat. And treatment is very exciting, no doubt, but we have been doing this in the last 10 years, the 20 years, the talks, but prevention we want to stress this time. Dr. Deepak, please.
Thank you, Arti. I'm sorry, my earlier talk, a million part of it was not audible due to poor connectivity because of the bad weather we are having in Chennai. It's important to know that prevention of stroke, as Gaurav said earlier, is more important than treatment of stroke. Preventing the stroke is most important. All action will be taken for prevention of stroke as a joint action by the patient, caregiver, society, government. All of us work together to prevent a stroke. What can be done to prevent a stroke? At an individual level, what do you do? As Padma had told you so beautifully, download the Riskometer app if you have a smartphone. Find out more about your individual risk of smoke and look for stroke risk assessment tool, and these are freely available. Science, World Stroke Organization has endorsed the Riskometer, which you can download and see. If you don't have your own smartphone, your friends will have a smartphone. Somebody will have a smartphone where you can just use it once in a way to look at your risk of stroke. Second thing, get your blood pressure checked regularly. It's important. All of us know blood pressure is an important risk factor for stroke. Always have a talk with a healthcare practitioner. All of us in school will have a classmate in school who would have been a good friend and taken to healthcare. This talking to him 2-3 times in a year will give you tips and take you through various steps to prevent risk of stroke. He will help you to implement positive lifestyle changes and reduce your exposure to bad air pollution in your country. Get support, talk to family and friends, and for reasons for preventing stroke, and identify ways you can help your friends and your colleagues and make positive lifestyle changes. Do not force other people to take alcohol, do not force other people to eat fried food, and do not make fun of other people who don't take alcohol in parties and they say, "Thoda le lo yaar, kuch na." Next, 1 in 4 people are at risk of stroke in their lifetime. By taking simple steps, many strokes are prevented. Next slide, please, Gaurav.
Yeah, please. I'm sorry. It's coming.
Yeah. 90% of stroke are risk to 10 key factors. Previous one. Controlling high blood pressure, as I told you, is almost risk to half the strokes. To control blood pressure, the chance of stroke will be less. Do moderate exercise, as a physiotherapist told you from Pune, at least 5 days a week, 20 minutes, make your exercise moderate. sure you eat a healthy, balanced diet. Sarthi told you all the new diets that are available on the, and he showed you good slides of it. Eating 5 portions of fruit or vegetables a week will reduce the risk of stroke. It's mandatory to control your cholesterol because 1 in 4 strokes in our country are linked to high bad cholesterol. Eating low saturated, non-hydrated fat instead of saturated fat will reduce the risk for stroke. You can't maintain a healthy cholesterol level with diet alone, then talk to a doctor. Some treatment can help. Important thing, maintain a healthy BMI. You don't need to be obese. You just need to check the person's waist or hip ratio. 1 in 5 strokes are linked to obesity. A good way to know that you need to lose weight is to divide your waist measurement by a hip measurement. If you have a number of more than 0.9, then you know you need to lose weight. As we are all you need to stop smoking and also avoid secondary smoking, not in not designated. In Chennai, we have strict rules. Smoking in a car, the police can smoke and get fined. I advise to reduce alcohol intake. You'll be shocked. During Diwali, we had 730 crores worth of sales in 3 days of liquor. That is how consumption of liquor is in Chennai. It is probably the highest center of brandy consumption in Chennai. People don't socially. You just see they stop the bike, stop the auto, get into the shop, buy the bottle, turn around, finish the bottle, drop it in the dustbin, then they get the bike or auto and go about. Not only a lot of women smoking. It's best for to take more than 2 units of alcohol.
So,
avoid alcohol. Irregular heart, silent irregular heart is nearly 10 cases of stroke. When you feel a palpitation, visit your doctor or the local government hospital. As we have been there, low intake of the risk of having a better intake will help us to more healthy. Having a better will help us insight into government policy improve positive impact on stroke and also other in Tamil Nadu. Our Chief Minister has done so much. All girls, free education, all and to help government decision, government, the health secretary, and take a leader role in stroke care and increase evidence-based stroke treatment, not only in type 1 cities, but also in type 2 cities. Unknown how television brought on by government and stroke treatment, even in small towns, supporting and coordinating the use of specialized stroke unit and stroke care teams will help for better care of stroke. Fund stroke awareness. They can give a little bit of their money for an awareness camp, as many of us have done today. Support excellence in research. Everyone must advocate together in one word for what can be done by healthcare providers. Understand medical conditions to patients with a treatment where the cardiac tracer is treated by the stroke. ACE inhibitors are given any supply and send you home. Many agencies like Rotary, Lions Club have given free of cost. It's important for patients to make patient clinics if they have got a cardiac problem. Blood pressure, pulse checks are recommended, and now that's not to do and support patients and help them to take steps forward, reduce a lifetime risk of stroke. Advocate for equal accessible care and the policies that promote community health. Kamesha Prasad, Padma have written so much to the government and so many guidelines have been provided for them. First, government and healthcare providers implement population-wide prevention strategies and address economic, environmental, and potential stroke. The removal of financial barriers to prevention screening and take leadership role in developing sustainable, low-cost assessment and management strategies, as has been published by Jayara Pandit, where home care, discharge, home care, physiotherapy will help patients. We need to work in partnership with healthcare researchers, have stroke survey, have support organizations, meet the unit once a month, have a stroke club, everyone to develop and give their experiences in stroke so the other patients will help and they will experience and the outcome of the patients in the stroke unit will be better. There are regional and global stroke prevention strategies which are published and available. Thank you.
Thank you, Deepak. And you brought out a very important point that in addition to, the government's responsibility is to provide optimal stroke care, which the ICU should be catered to look after the fever, the swallowing, the hypertension, the diabetes control immediately in the stroke period, in addition to thrombolytic therapy. And there should be provision for at least stroke insurance and some type of reimbursement for the stroke sufferers, because it's a leading cause of death and disability in India. With that, we go on to the secondary prevention. If Arvind Sharma is there, I would like him to come and deliver his talk. Otherwise, I'll just briefly mention about secondary prevention to complete this forum. And secondary prevention occurs once the stroke happens, and stroke happens, there is a chance that it is possible that stroke will come again. So the survivors are at the threat to develop stroke again. There is what you should do is the correct adherence to treatment that is prescribed, antiplatelet agents, or it will be anti-cholesterol agents. Your diabetes should be under control, hypertension should be under control, and you should stop smoking and reduce alcohol intake. Use regularly that anti-cholesterol agents are lipid lowering agents. And there are some surgical treatments available. If there is a carotid stenosis, you can do carotid endarterectomy, and or you can angioplasty is there. And in cases of atrial fibrillation, then the secondary prevention consists of advanced anticoagulation with NOVAX nowadays. Novel anticoagulant agents are available for the isolated atrial fibrillation cases. So all these things will prevent. These are the secondary prevention strategies. And this, I asked Dr. Partha Ray to come into and talk about a bit about spasticity and incontinence quickly, because we have a paucity of time and we have to finish fast. Right, Partha? Right, Partha, are you there?
Yes, I am here, sir.
Yeah, please.
Yeah. Just making sure that you can see my slides. Right. Yeah. Is my slide coming up at your end?
Yeah, it's coming.
Yeah, very good. Yeah. Right. I'll shift gears now, and I'll speak in English on popular demand. And if there were any words I said earlier on which were not in the correct context, my apologies. Right. In the interest of time, we did speak about prevention in my first talk. Unfortunately, despite doing all that, some of us will go on to have strokes. So the main important complications are one of spasticity, and that is becoming an incontinence. So just for the common person, what is spasticity? It's when the limb becomes stiff after a stroke. And usually to be able to stand or bend, there is a mutual interplay between something that bends the elbow and something that flexes the elbow, and they work in tandem or at the same time. When that balance is disturbed as a consequence of a stroke, that's when patients develop spasticity. Unfortunately, about a third of stroke survivors go on to have it. And if it's not attended soon enough, then the next stage proceeds to a contracture, because then the muscles and the tendons also don't function properly over a period of time, and the joints become fixed. And that becomes a real rehabilitation nightmare, because it eats deeply into the activities of daily living. And for our allied health personnel who rely on us to give them a patient who they can work on effectively, a big time investment. And often the results are not as satisfactory as they might have been. And there's, of course, shoulder pain and pain in other parts of the body as a consequence of all this happening. Now, when does rehabilitation start? Now, Professor Nirmal Surya is a mentor and a good friend, and he has actually drilled into all neurologists that rehabilitation should start as soon as possible, practicable and safe. So in my books, I see rehabilitation starting pretty much at the point of diagnosis after the initial hyperacute stroke management. And there are regimes, which means that there should be quality, the dose of physiotherapy, occupational therapy, speech and language therapy, psychological therapy, all comes in the same package. And again, Abhishek Srivastav talks always about having clear goals agreed between the patient and the therapist, because no two patients will be the same, their expectations of life, their needs of the rehabilitation service. So coming back to the spasticity concept once again, what's the treatment? There will be a heavy input from physiotherapy, occupational therapy, who will be providing with specialized equipment. And of course, there'll be more modern gadgets, some of which I mentioned here, like functional electrical stimulation and traditional ankle foot orthosis there. Now then, so what are the treatments for spasticity? The stretching that is initiated by physiotherapists can be continued by the family members and carers, because as we all know, there is a huge dearth of physiotherapists and allied health professionals. So how do we supplant that? The family members and carers should become active participants in the process of rehabilitation for as long as it takes. And then, of course, the specialized interventions like botulinum toxin therapy under EMG and or ultrasound guidance are all there to help with correct localization and dosing for cost effects as well. And the traditional medicines that we use are also important. Now, shifting gears, because this is a time issue, bowel and bladder problems are also very common after a stroke. And these are very subtle. Patients from, conservative countries like India have difficulty coming out with these expressions to their doctor, but it is a huge care burden for pressure sores and other things, as well as quality of life and psychology of the patient, losing control. And I've enumerated out here the reasons why the bladder control goes in patients. And there's, of course, a paradox between constipation and bowel incontinence, and I'll come to that. The types of bladder and bowel problems are quite varied, and I leave this slide up for members of the audience, the public, to look at, because this comes in a variety of ways as to how the bladder problems might manifest: frequency, urgency, nocturia, nocturnal enuresis, functional incontinence. You can read that. And again, there is fecal incontinence, very embarrassing. It takes away the person's quality of life. So how is treatment of bladder problems engaged upon? Well, there's this pelvic floor exercises that's very important, as we do in postpartum women. The same principles apply, but this time neuronal circuitry. We haven't touched upon spinal cord strokes. That's a totally different entity as well, but it comes in the same rubric as well. Bladder training as well comes in here. Infections of the bladder, particularly if there is indwelling catheters for some time, it leaves patients with reduced bladder volume. And then again, things that patients do without knowing, taking lots of caffeine can promote before going to bed, taking diuretics before going to bed at night, just shifting it around helps. And then again, the bowel problems, there is either incontinence or constipation, and then addressing them both in its entirety is so very important. We don't have a topic to discuss sexual functions and relationships issues out here, but so much linked up with these common nerves that get disturbed. And unless raised with the patient, it's often not discussed. And it's a huge care burden and spouse relationship issues, which I think is important, more so with young and old patients having strokes. It's important for a quality of life issue. So who do we approach for these? I think it's a full team approach. Once again, we're talking about the comprehensive neurological rehabilitation team. I wish there was more of us around who could provide this service: doctors, nurses, therapists, continence experts, patients who can be provided with ankle foot orthosis, rollator frames. There's a huge list of gadgets that can help work around spasticity, incontinence pads. It limits social interaction. It leads to embarrassment. People don't want to talk about it. We as facilitators, our duty is to explain to the patient, improve the education levels, increase the acceptability, and then patients will have a far greater quality of life and be able to come back to near normal life, as well as we doctors can do, because there is this plasticity element that's going on in the brain all the time. And it's an ongoing process. So rehabilitation starting pretty much as soon as possible and continuing on with professional therapists, family members, and including patients to tweak the neuronal plasticity, and with the active intervention in the acute phase, hyperacute phase, with the rehabilitation stepping in and all the interventions, I think the stroke outcome is going to be fantastic. But we mustn't forget the prevention as the first strategy. And when we are in it, the whole kitchen sink, as they say in England, to be thrown at the stroke to make sure the patient wins over the stroke, and having patient advocacy groups to push the policy forward with lawmakers and with government, with all that Dr. Arjun Das was saying, will be a wonderful way to see how we manage this enormous burden, and we don't want it to increase. So thank you very much, and Jai Hind, and thanks again to Indian Academy of Neurology. I hope I spoke in no Hindi.
Thank you, sir. And
okay.
See, there are few things which I'm not able to complete because of paucity of time.
Yes,
I have to excuse. My apologies to Dr. Padma for not giving time to talk about cognition and mood, and also to Dr. Swati Bise. I'm not able to give you time to do your ADL and mobility things, and I'm not able to give time to Dr. I'm just showing the slides and rehabilitation team and these things which we have to do at some time later. But I also say sorry to Dr. Deepak for not allowing him to take his. So Deepak and we'll take up this Global Stroke Bill of Rights at some other time in our stroke meetings. So I conclude by saying that don't be the one to get a stroke. When it comes to stroke, don't be the one, and you have to be present. You have to, in fact, prevent the stroke. And when it comes to stroke, don't be the one. One of us will struggle to say, I love you again. 1 in 4 of us will have a stroke in our lifetime, which can cause speech difficulties. However, most strokes are easily prevented with simple steps. When it comes to stroke, don't be the one. That's the final message. And I hand over the mic to Dr. Kameshwar Prasad for his remarks. And after that, it will be Dr. Meshramji for his final remarks. And in the end, there is a slide which I'm going to flash, which is done by Dr. Purnima Gauri from Nishi Academy, a 15-minute YouTube documentary on stroke, which can be visualized by everybody. And I'm very proud of her. She has made a good documentary for stroke and stroke of luck. So with these few comments, I invite Dr. Kameshwar Prasad for his comments. Dr. Prasad, sir?
Dr. Kameshwar Prasad, are you there?
Dr. Kameshwar Prasad, sir, is there.
Tell me.
Yeah.
I told you I had to go somewhere at 8 o'clock, but you see, we are talking so much about exercise, but this is my exercise time at 8 o'clock. Right? So while we was talking, I was thinking I'm undoing my own precepts. It's better to practice what we preach, you know. So tell me anything you want me to do.
Yeah, please sum up the session in 2 minutes. Your 2 minutes comments about on this occasion about stroke. The take-home messages.
Well, all I will say is that speakers are fabulous. They have done their good homework, good job. And I have nothing much to add, except saying that people who use the word blockage and burst should be replaced for general public by leakage. It should be blockage type and leakage type. Bursting gives a very drastic connotation and catastrophic, which may be true, but it frightens the public. So but if we are talking to the public, use the word blockage and leakage, that everybody understands blockage, everybody understands it occurs in their pipes. Leakage also everybody understands, but please avoid using the word burst. The second comment I will give is that the riskometer is no use if it gives wrong prediction. And all these riskometers which are being promulgated or are not for Indian people. And the validation, so-called validation, is not proper. So I think we should be very cautious in spreading it, because it is, I would say, poorly validated for Indian population. And the third thing I have to say is that I think we have to, when we are talking to the public, we should have very little matter on the slides. All the slides I have seen are full of matters which are probably not readable, and only people who are presenting can read it. So there are certain methods of some slides were good, of course, but some slides were full of material which I think people may like to avoid if they are talking to the public. And there are rules for making slides. I'm not going into that, but it is better to avoid crowded slides, particularly when you are talking to the public. So these are few of my comments. I'm not summarizing the message. They have already given very well. I always say that 4 into 4, 4 things related to lifestyle and 4 things related to diseases are to be taken care of. 4 things related to lifestyle is your diet, smoking, alcohol, fruits and vegetables, of course, comes under the diet. Keep your body weight proper, do regular physical exercise. And 4 conditions to be kept in check: high blood pressure, high cholesterol, the high blood sugar, and heart disease. We talked only about atrial fibrillation in India. Talking about rheumatic heart disease is equally important, because still there is a lot of rheumatic heart disease. So if we keep all these things under check, then I think we can prevent as much as we can. Of course, obstructive sleep apnea is also coming up as a risk factor, but it's something which we should keep in mind, not easy for people to follow, and expensive equipments are required. So I think if we restrict to 4 into 4, it will serve the purpose. Thank you.
Yeah, thank you, Dr. Kameshwar Prasad. I think we had a very wonderful session. बहुत अच्छा session रहा, Dr. Gorthi. Thank you very much.
Thank you, sir.
And all the panelists, Dr. Padma, Dr. Deepak Arjundas, Dr. Parthare, and Dr. Swati Bhise. They made a very important comments, and would like to thank Dr. Nirmal Surya, who was here, and Dr. Sunil Narayan. And Dr. Jairaj Pandian was in a flight when our session was going on, so he could not join the session. Same is true for Dr. Arvind Sharma. So I think we have a very wonderful session, and it is important that stroke is a brain attack, and it is more important than the heart attack. And you must identify early signs and rush. It is a medical emergency. Rush immediately to the hospital. Don't delay, because every second is important when it comes to brain attack. More you delay, the more damage and less recovery will be there. So it's a medical emergency. So you identify the early signs of stroke, and don't neglect that this could be because of acidity, this could be because of blood pressure, this could be because of exertion or tension or any other thing, that you think that any change from the normal function could be a first symptom of stroke, and you must rush to the hospital immediately. I think
Dr. Mishram, let me just add one sentence to tell that, if you your kind permission,
yes,
that we had to take this campaign throughout the year. Today is the World Stroke Day, but then it's so very important to continue the campaign, especially of early recognition of this stroke and the awareness of the treatment availability, the various treatments available, and identifying the stroke centers nearby, and also all the detailed, very important preventive factors. There has to be a sustained campaign. I would like to seek the support of all of you in this campaign at your own levels, so that the messages should be repeatedly going out to the public through all the media available, television, newspapers, not just sticking to this week around the World Stroke Day, but throughout the year. And that only can certainly, that will surely make an impact, because we have so much of material always being thrust upon us through the media. And I'm sure that the stroke should join the queue and find its way to penetration more and more, so that the effective preventive and treatment strategies will get even better. Thank you very much.
Thank you.
Happy weekend.
Dr. Gorti would like to say something about this movie?
No, sir, just it's wonderful having all of you. I thank everyone for their contribution in the success of this panel discussion. And this documentary, which I'm showing on YouTube channel, is made by Dr. Purnima Gauri, which should be seen by all the public for getting the first-hand knowledge about the various modalities of investigation and treatment. With this, thank you very much, sir, for giving me this opportunity to be the moderator. And I thank Indian Academy of Neurology, Dr. Nirmal Surya, and Dr. Meshram for allowing me to conduct this session. Thank you, sir.
Thank you, Dr. Gorti. And I would like to thank the audience participating. Please, whatever information you got, please spread it among the general public and tell others that how the stroke is important, how to recognize stroke, and the risk factors, how to control the various risk factors. Thank you very much, and good night.
Right,
and
sir.
we'll,
Good night, sir.
See you again for the next public education program. Thank you very much.
Thank you, Dr. Mishra. Namaskar, sir.
Thank you. Goodbye.
Namaskar. Jai Hind.
Thank you, Mansi.
Thank you, Mansi. Nice.
Thank you.
Okay, then we'll close. Thank you.